Obesity is a chronic, complex disease, not a personal failure, and more than 1 billion people worldwide now live with it, across children, teens, and adults alike. Today's video explains what obesity really is, why it happens, health risks, how it's measured, and evidence-based paths to improvement, ending with real hope and practical steps anyone can start now. What is obesity? The World Health Organization defines obesity as excessive fat accumulation that impairs health, typically screened with body mass index (BMI), and supported by other measures like waist circumference and clinical assessment. For adults, overweight is BMI is greater than or equal to 25 and obesity is BMI is greater than or equal to 30. While children use age and sex-specific growth references because BMI cutoffs differ across ages and development stages. How common is it? Global prevalence has surged. As of 2022 to 2024 estimates, over 1 billion people live with obesity, about 880 million adults and 159 million youth, reflecting a multi-decade tripling among adults and a tenfold rise in 5 to 19-year-olds since 1975. Many of the deaths and disability from high BMI now occur in low and middle-income countries, highlighting that access to healthy food, active living, and responsive care are global challenges, not just issues of wealthier nations. Why BMI isn't the whole story? BMI is a quick screening tool, but it's a crude population measure. Muscularity, ethnicity, age, and body composition can affect interpretation, so clinicians often add waist measures and metabolic risk factors. Asian and South Asian populations can face metabolic risk at lower BMI values, and several authorities recognize lower BMI thresholds in these groups to better capture risk. Waist circumference and visceral fat. Waist size helps assess central visceral adiposity. Classic thresholds of is greater than or equal to 88 centimeters for women and is greater than or equal to 102 centimeters for men signal higher risk, though ethnicity-specific cutoffs vary and combined BMI plus waist better predicts risk than either alone. Some public health groups flag increased risk above approximately 80 centimeters in women and approximately 94 centimeters in men, underscoring that lowering waist by even a few centimeters can meaningfully improve cardiometabolic risk. Health risks linked to obesity. Excess adiposity increases risks of type 2 diabetes, high blood pressure, dyslipidemia, sleep apnea, osteoarthritis, fertility issues, and several cancers, and it can impact daily function like moving and sleeping. Cardiovascular disease risk rises with higher adiposity through both indirect pathways, for example, diabetes, hypertension, and direct mechanisms, with genetic and Mendelian randomization data supporting causal links to CVD and related conditions. Obesity is associated with elevated risks of at least 12 cancers, including endometrial, colorectal, postmenopausal breast, pancreatic, liver, kidney, and esophageal adenocarcinoma, with stronger relationships for some tumor types. Why obesity happens? Biology and environment. Obesity is not just eat less, move more. It's a neuroendocrine and metabolic condition influenced by hormones like leptin and ghrelin, which can develop resistance and obesity, altering hunger, satiety, and energy expenditure. Modern food environments, economic development, ultra-processed foods, stress, sleep disruption, and limited access to active transport and healthcare all contribute, particularly in settings with constrained healthy options. Children and teens. Global pediatric obesity is about 8.5%, 2000 to 2023 data, with notable regional variation, and is linked to factors like sleep duration, sedentary screen time, maternal obesity, and breakfast habits, plus mental and physical comorbidities. Early intervention matters because childhood obesity often tracks into adulthood, raising risks of hypertension, diabetes, and depression. Family-based, supportive strategies can help offset these trends. How clinicians diagnose and stage. Clinicians start with BMI and waist, then check blood pressure, fasting glucose, HbA1c, lipids, sleep apnea symptoms, menstrual androgen patterns, liver enzymes, and joint issues to assess complications and personalized care. For children, BMI 4H percentiles are used rather than adult cutoffs, and growth references are essential to accurately identify overweight and obesity during development. Lifestyle foundations that work. Nutrition. Patterns emphasizing minimally processed foods. Vegetables, fruits, legumes, whole grains, lean proteins, and healthy fats can support sustained weight loss and metabolic health. Structured patterns like Mediterranean-style diets have strong evidence in weight and cardiometabolic outcomes. Physical activity: aim for at least 150 minutes per week of moderate aerobic activity plus muscle strengthening on 2 days. More can yield additional benefits and supports weight maintenance after loss. Sleep and stress: short sleep and high stress dysregulate appetite hormones and insulin sensitivity, making consistent sleep routines and stress reduction practices important pillars of care. Medications: a new era. GLP-1 receptor agonists like semaglutide 2.4 mg produce mean weight losses around 15 to 17% with cardiometabolic benefits, marking a step change compared to prior medications. Dual and triple agonists such as tirzepatide GLP-1 GIP with up to approximately 22.5% weight loss in phase 3 trials, and investigational combos like retatrutide, GLP-1, GIP, glucagon, and amylin combos suggest medication outcomes approaching surgical ranges for some patients. Metabolic and bariatric surgery. Surgeries considered for severe obesity and obesity with complications, producing large, durable weight loss and improvements or remission in diabetes and other conditions when paired with lifelong follow-up. Even with advanced pharmacotherapy, surgery remains the most effective option for many with severe obesity, and care teams tailor choices based on health status, preferences, and response to prior treatments. Weight stigma and language. Stigma harms health by promoting avoidance of care and mental distress. Using people-first, respectful language and recognizing obesity as a chronic disease fosters trust and better outcomes in clinical and community settings. Framing goals around function, energy, metabolic health, and small sustainable changes helps maintain progress even when scale numbers slow due to adaptive metabolism and set point biology. Practical 4-step starter plan. Step 1. Assess and track note BMI, waist, blood pressure, glucose, and lipids. Small waist reductions can significantly lower risk, and combining BMI with waist improves risk prediction. Step 2. Food shifts: add 1 serving of vegetables and 1 palm of protein to 2 meals daily. Swap 1 ultra-processed snack for nuts or yogurt. Build from there week by week for sustainability. Step 3. Move more: commit to 30 minutes brisk walking 5 days a week plus 2 short strength sessions. Activity supports weight maintenance and cardiometabolic health even before major weight loss. Step 4. Medical options: talk to a clinician about medications like GLP-1 South or, when appropriate, surgical options. Personalized, stigma-free care can unlock progress when lifestyle alone isn't enough. And hope message: obesity care is advancing rapidly. Today's treatments target biology, not willpower. And millions are finding better health with a blend of nutrition, movement, sleep, stress care, medicines, and sometimes surgery. Progress, not perfection. Small steps, strong heart. Every day is a new chance to heal. Health is a journey, walk it with hope. Like, share, and subscribe to spread evidence-based hope and practical tools to everyone who needs it. Someone's next step might start with this video.